Now, a coalition of universities have joined hands to make emergency ventilators that will work without electricity. The Northwest University is among the team. It's also making and distributing face shields for health workers in and around Potchefstroom. Associate Professor Linda Grobler leads the team of engineers, and she joins us on Skype from Potchefstroom. Good morning to you. Tell us how this is going to work.
Good morning. Since 2019, we started with a plan on working together in terms of a national ecosystem of universities focused on the medical device development field to take products from ideation to a product at the end of the day. And when COVID-19 struck, it just gave us that extra push to start working together because before that we didn't share a common problem to work on. So. We have chosen the Bird mechanical ventilator, the Bird Mark 7 specifically, to focus on and to re-engineer this remarkable piece of equipment that originated in World War II. So it's from the 1950s. It only requires pressurized air to be able to work, and it also can be deployed for both non-invasive and invasive ventilation. So it really is a worthwhile piece of equipment to consider.
Okay, in layman's terms, and it's for me here really, what is the difference between what we have at the moment and the way it works to what you are proposing?
Okay, now many people haven't been to an ICU before, and if you have been there, you will know that the normal ventilators used these days are very complex, very intimidating devices that do a lot of complex electronic calculations, and it regulates breathing for the patient. Now, a mechanical ventilator, like the one we are investigating, uses a very simple interface. So it's normal knobs that you can turn, valves that you use to actuate the air, and it is not necessarily unconceivable jargon that you are confronted with. So it is simpler to use, especially since the very big constraining factor in the country at the moment is yes, there's not enough ventilators, but there's also significant constraint on the number of trained ICU nurses being able to use those complicated machines.
Okay, so it's more simplistic. I assume it's cheaper. How quickly can you churn these out? Well,
the great thing is that since we are this collaborative team between the Northwest University, the Central University of Technology, and the Vaal University of Technology, we were able to take these machines that we found still in stores throughout the country, like at Groote Schuur and Tygerberg hospitals, and we were then able to use the National Scanning Facility at Necsa to do CT scans of the existing parts. So we have complete 3D models at the moment of these parts that would normally take months to reverse engineer, and we were able to do in weeks. And now these parts were digital files were then sent to the Central University of Technology. They have the only medically safe and regulated 3D printing facility in the country. So now they can 3D print the essential parts. And those parts that don't need to be recreated, we can buy as commercial off-the-shelf parts. So we can manufacture these in a matter of weeks instead of the normal months that it would have taken just to get the molds ready to start production.
Okay, well, I hope you can start as soon as possible. I believe at the same time you are handing out face masks. Talk us through that.
Yes, we have designed and have been printing and cutting face shields. That is an additional layer of PPE that can be worn by medical staff over their masks as an additional layer of protection. Many universities throughout the country have been doing this, and I think that's really also the success of providing this, since many hobbyists and other universities are assisting in this, we can, in a distributed manner, actually protect the people that serve us.
Okay, Linda Grobler, good to talk to you. Thank you.